Welcome to Building Healthy Connections, a space for healthcare professionals to understand how culture impacts healthcare. And now your host, Berthine Crèvecoeur-West.
Good morning, this is Berthine Crèvecoeur-West, and I'll be your host for Building Healthy Connections. We'd like to thank you for tuning into our last podcast. We were thrilled to have so many people tune in, so please continue to tune in because we've got a lot more wonderful information coming your way. So today, we're going to discuss certification and a certificate of successful completion. So you're an interpreter, or you'd like to become an interpreter, and you're ready to take that next step. Well, the first step is to receive professional training. So what does that look like? Is it a 10-hour class, a 6-hour class? No. Actually, it's a 40-hour class. In the state of Georgia and in many other states throughout the United States, all healthcare interpreters or people seeking to become healthcare interpreters have to take a 40-hour class. This is the basic minimum training that every interpreter needs in order to work at any healthcare facility, namely hospitals and clinics. So, what does that look like for you? The first thing I would suggest is going to the IMIA or CCHI websites. Now, what's the IMIA? That's the International Medical Interpreters Association, and CCHI is the Certification Commission for Healthcare Interpreters. These two resources are going to become your best friends as medical interpreters. Why? Because they're chock full of information that will help you with your medical interpreter education and certification. What you would first do when going to these websites, and we'll list them in our blog, so don't worry, you won't miss out on anything. What you'd first do is go into their websites and you would look under the education tabs for both of those organizations. There you can find 40-hour classes as well as certification prep classes. Another thing you can do is go to the Medical Interpreter Network of Georgia website. That's MING. We'll also put that in our blog as well. So on the MING website, you'd go to the education page, and there you'll find a listing of 40-hour classes to take. So once you've done that and you've found the course that suits your needs, well, actually, let me preface that. You want to make sure that any class you take that's a 40-hour class is trained by a professionally trained healthcare interpreter, preferably one that is nationally certified. I always like to say, I love to watch episodes of House, but that doesn't mean that I can perform brain surgery. So interpreters are the ones best skilled to train other interpreters. Please keep this in mind when you're signing up for these courses. Also, be prepared to know that this, in addition to a time commitment, is also a financial commitment. Most medical interpreter training courses, professional medical interpreter training courses, I should say, cost between a total of $600 to $1,200. So know this and do your research. And also, keep in mind that a lower price does not always mean better quality. So be prepared before going in. Sometimes the class that costs the most isn't the best one either. So find what works for you. Ask questions of the trainers. Ask them if they're nationally certified. Ask them how long they've been trainers. And I would even suggest ask them from where they received their training. This is really important because we want to make sure that you receive the best quality education possible. Now, having said that, once you've found your 40-hour course, then what do you do? Once you've found the course, another thing to mention is, again, the time commitment. Most courses can be within 40 hours. Courses can take place within 1 week, Monday through Friday, every Saturday for 8 hours for 5 Saturdays, or they can take place on Saturdays and Sundays. So be aware of the time that you have to dedicate to this course. And know that this course has to fit into your life. We understand that many people seeking to become healthcare interpreters are working professionals as well. So make sure it fits into your life, because if you cannot attend every day of the course, you won't receive the full benefit, and then it becomes useless. So make sure that it fits into your schedule, it fits into your budget, and now you're ready to take the course. So let's fast forward. You've taken the course, you've successfully completed the course, now you've received your certificate of successful completion. What that now means is that you can work at any healthcare facility, hospital, clinic, what have you, within the United States. That's another thing you want to ensure, that the course that you have taken will allow you to work in any of the states. It has to be a portable course. Many courses are, but beware because some may not be. So again, research, research, research. So now that you've gotten your certificate of successful completion, you're ready to become nationally certified. Now, let's explore the differences of what national certification means. There are only two nationally certifying bodies for healthcare interpreters within the United States, and those are the National Board of Certification for Medical Interpreters, also known as NBCMI, and then the Certification Commission for Healthcare Interpreters. These two entities are the only ones that can grant national certification to any healthcare interpreter who has completed a 40-hour class successfully. So, again, be wary if you see a place offering certification for medical interpreters. If it's not from one of these two entities that I just mentioned, then again, you have to start asking them the difficult questions because this impacts your career and your future. Oftentimes, interpreters who have already been working, let's say for several years at a hospital, and now the 40-hour requirement has kicked in, this is important for them to know in particular because getting your certification from one of these two bodies will have a direct impact upon your job. We want you to keep working, so we're here to help you do that. So now let's talk about the big question everyone always asks. How much is that going to cost me? Well, with regard to certification, payments are usually made in three ways. So first I'll talk about the similarities that these entities both share, and then we'll talk about some of the differences with regard to testing. So the first part of the cost, the cost is broken down into three parts. The first part is usually a $35 fee for registration. So what you have to do when you register, and thankfully you can do this all online. So when you register, make sure you have your government issued ID, that could be your driver's license, identification card. Make sure you also have a digital copy of your resume and any other documentation. And we'll, again, put this on our blog, so you'll be able to see that there. So once you have all of these at your disposal, you begin the process to apply. Now, this usually takes 30 to 40 minutes online, so make sure you have the time to do so. I would suggest doing it in one shot because stopping and starting, you might miss some information, and then that will just have to take you right back. Please note that if you submit any information that is not complete, they will return your email to you and ask you to go and review, and that's just going to take more time. So we don't want you to do that. Now, once you've done that, you'll be ready to take the written exam. The written exam is computer-based, so your results will be immediate. Now, that's a great thing for you because then you won't be stressing about how long will it take to get my results. I always suggest the moment you get your results, which you can print out at the site, bring it then to the companies for which you work or the hospital system for which you work so they know your score and they can keep that in your file. And then they know that you'll be ready to take the oral exam. The oral exam, we should note, is offered in only a limited amount of languages. So for National Board, the oral exam is offered in Spanish, Russian, Mandarin Chinese, Cantonese Chinese, Korean, and Vietnamese. For CCHI, the oral is offered in Spanish, Arabic, and Mandarin. We'll talk about what that means to you in a little bit. So now you've taken the oral, the cost is $195, and those results will take 3 to 4 weeks for you to receive. So be prepared to expect more along the 4-week side. With regard to the oral, you have numerous people grading your exam. So with regard to CCHI, you literally have 14 interpreters grading your exam as an example. So what does that mean and why are there so many graders? Let's use Spanish as one of our examples. There are different variants of Spanish as we've mentioned. So perhaps a term you would use if you were speaking Argentine Spanish would not be the same as if you were speaking Mexican Spanish or Dominican Spanish or Puerto Rican Spanish. So the reason for all of these graders is to ensure that everyone is in agreement with the variant that you are using. If you happen to speak Castilian, that is usually the norm. However, we want to ensure that everybody is graded fairly. So that's why we have so many people grading you. And then, why are there only a few languages offered? The reason that only a few of these languages are offered in the oral portion of the national certification exam is that we have to account for the major languages spoken. So it's an issue of demand. So let's say Wolof. It's an African language that is spoken. There's not going to be an oral exam in Wolof because there's simply not enough Wolof speaking interpreters. However, it's important to point out that even though there's not an oral exam in your language, both national certifying bodies account for that. So for instance, I'm a Haitian Creole speaker, but I'm nationally certified. Why? Because I have a particular distinction. For National Board, you will receive your QMI. That's a credential you receive when you've taken the written exam. That states that you're competent in healthcare interpreter skills and terminology as it pertains to an English-only portion. CCHI has a core CHI, a credential. So that's a core certified healthcare interpreter credential. Now, mind you, what if you speak Spanish and you've only taken the written exams? You cannot receive these credentials because if an oral exam exists in your language that you speak as an interpreter, you have to take it before receiving any credential. So then for Spanish, you would receive a CHI if it was from CCHI, or you would receive a CMI, a certified medical interpreter credential, if that was from National Board. So you notice we'll be using a lot of acronyms. Not to worry, you'll find them in our blog. We'll define everything for you because we want to empower you for success. So now you've taken the oral, the written, you've done your registration, and you're waiting for your grades. The next question people ask me is, what's going to be on the test? Now, naturally, I can't give you that information, but I can tell you what you should be studying. Both tests cover medical terminology, medical specialties in working languages. That refers to English, that's the source language, and the target language. That's the language you'll be interpreting from English. Then the roles of the medical interpreter, cultural competence, interpreter standards of practice. And I should note that there are 3 recognized interpreter standards of practice. There's CHIA, that's the California Healthcare Interpreters Association, IMIA, as we mentioned earlier, International Medical Interpreters Association, and NCIHC, that's the National Council of Interpreters in Healthcare. Again, don't worry, you'll find this on our blog. So once you've done that, then the next question is, now, what's the difference? That I can tell you in a very short sentence, or maybe not so short, but that one for National Board, you are tested on all of these things, but the percentages are different from CCHI. So National Board is more terminology based. So I would suggest the person that has completed their 40-hour class is not very familiar with the world of medical interpreting besides the courses that they've taken to take that one. But CCHI is more job skills based. So that I would suggest for interpreters who have been working in the field already. If you are new to the field, the CCHI certification exam would not be the best option for you because you simply don't have that experience. So if you want to take the CCHI exam, I would suggest working for a year because you want to build up that good amount of professional experience, and then you can apply that to your exam. So both exams are equal insofar as their accreditation that they offer. Both exams are equal insofar as the difficulty involved. They are difficult exams, but doable exams. So again, if it was easy, everybody would be a healthcare interpreter, but you're special. So this is why this is for you. So having said that, both exams are the same, but they test different things differently. So the amount of medical terminology, that doesn't mean you should know less for one. You should know equal amounts for both, but be prepared to be tested on certain job skills for CCHI. Also, with regard to modes of interpreting, that's tested as well during the oral. So for National Board, you would be tested on consecutive interpreting, but for CCHI, you'd also be tested on consecutive and simultaneous, as well as short translation. So be prepared for that to happen as well. Now, we're going to wrap up with the particulars of the exams, and we'll get to the questions that people tend to ask us. And so I'm always asked, why should I become nationally certified? Will I get paid more? Will I get paid more? Why or why not? So I'm going to break that question down for you guys. Why should you become nationally certified? The medical interpreter is the non-clinical member of the clinical team. So what that means is if your providers are board certified, let's say your doctor, and then your nurse is board certified, if I was the LEP, then you, the interpreter, have a responsibility to reach your highest level of professionalism as well. And that means certification. Also, national certification is something you can carry with you throughout any of the states of the United States. So if you move to Hawaii from New York, you can still be a nationally certified medical interpreter. That means you will be gainfully employed. That means that literally is your PhD in the field of interpreting, where the 40-hour class is your bachelor's degree. So why not be a PhD, right? You will get, and I will tell you, most people in our field do not know what certification means for us, but they always ask, oh, are you certified? What does that mean? And then you can explain to them. It lets them know, too, that you have reached the highest pinnacle in your career. So this is an important thing. And you will help professionalize the profession. So that is really important. So you're doing it, one, for yourself, but you're also doing it now for the professional medical interpreter community. And that is going to have huge impacts. Now, there has to be a critical mass of interpreters that are nationally certified in order for interpreters to get paid more. So what does that mean for the healthcare interpreter? If one person is nationally certified, you're not going to get paid more. That wouldn't make sense for the healthcare facilities. But what if we have 1,000, 20,000? That will have a difference. Our voice then will be heard more because there'll be more of us. So by definition, we'll be louder. So what is that saying? The oil gets the squeaky wheel. Be the squeaky wheel. Get the oil. So that would be a good thing. But I have to say that should not be your only motivation because that will take years. It will take years. Currently, right now, for both organizations, there are I will say there are approximately 2,000 nationally certified medical interpreters in the United States. Now think about the size of the United States. We have 350 million people living in this country. And so let's think about how many of those would be LEPs. And I'm going to throw out a random number. So don't fact check me on that one, but I'll throw out a random number and say, let's say 10% of that population were LEPs as an example. So that would mean 35 million people. So you're telling me that 2,000 interpreters can serve 35 million people? We simply cannot. Although it would be great to be everywhere at once, we cannot do that. So we need more people to become nationally certified. Now, having said that, there are thousands upon thousands of people working as quote unquote healthcare interpreters who not only don't have their certification, but they do not have the training that is necessary to do their jobs effectively. That results in lawsuits, greater healthcare costs, and really the deprofessionalization of our particular field. And we cannot have that happen. So as a nationally certified interpreter, you would also become an ambassador of the profession. And now we'd like to take a moment to thank our sponsors. The West Linguistic Training Group, LLC, offers a variety of innovative training courses that promote corporate training, media and school translation services, interpreter education, and mediation services. Visit their website at www.westgrouptraining.com. One Voice Medical Interpreters, providing high-quality and dynamic language solutions to organizations in the medical field to help them achieve a fluid communication and a better connection with their patients. Visit their website at www.onevoicemedical.com. Now your job is to go out and educate not only the general public, but the healthcare community at large about the field of professional medical interpreting. Now you'll be deemed the expert in your field. Now, it should be noted too that being the expert doesn't mean we stop learning. on the contrary, the expert continues to educate themselves. That's a part of the medical interpreter code of ethics. So professional development is one of the tenets of the code of ethics. So continued professional education is what you'll see from a nationally certified medical interpreter. Not only because you'll be required to do so in order to maintain your certification, but this will help you become more enlightened about your role in the healthcare community, in the community at large, and how you can proceed as a medical interpreter, because you will face many difficult situations. And so being nationally certified empowers you to deal with those situations and find the solutions and the resolutions that you need in order to be as competent and effective as you can be. So it'll benefit not only you, but the healthcare profession as well as the LEP community. So eventually, I do anticipate that people will get paid more. For certain interpreters, if you are a freelancer, by virtue of being a freelancer, you can charge more for your services. And we want you to keep that fair as well. So that's something that we can discuss in a future podcast because we have to look at interpreting from the business side as well. But if you work for a hospital system, again, there needs to be a critical mass of interpreters. So let's say you work in a team of 14 interpreters for an area hospital. Let's say it's a large hospital. That hospital may not pay you more necessarily right now, but when the other members of your team become certified, that elevates the financial bar as well. So there is, in addition to the professional incentive, there's the financial incentive that exists out there for you. But remember, there needs to be a critical mass. So you've got to be patient about that. But I say, and I suggest to you wholeheartedly, be ahead of the game. I was, as you might see in my bio, the first nationally certified medical interpreter in the state of Georgia for Haitian Creole. Now, being the first was fun, but being the first is not a good thing. Now I'm happy to say that there are several other nationally certified healthcare interpreters for Haitian Creole in the state of Georgia. And that is a great thing because we're building and moving towards that critical mass. So being the first, awesome, but not enough. Being one of many, that's where we want to reach. That's our goal and that's our objective. So on that note, I would suggest that you send us in your questions because we can talk about this again during a later podcast. Let us know your thoughts. Let us know what you think. Let us know if this has been helpful for you. We are hoping that it has been. So thank you for tuning in to this latest episode, and we look forward to seeing you, or talking to you next time.
Thanks for listening to this episode. Stay connected through our website, www.buildhealthyconnections.com, or through our social media channels.